Hello, this is Eitan Shalom at the Body Mind Wellness Center, and I want to show you how I'm doing dry needling on the coracobrachialis muscle, as well as the two branches of the biceps, and how I'm needling into the tendon of the long and short head of the biceps. And this is an image of the coracobrachialis, which is one of the primary flexors of the upper arm. And this patient is a martial artist, an older person, martial artist approaching 50, and he came in with frozen shoulder and great difficulty moving his arm. And now he's back to 100% normal, other than when he does a particular movement in martial arts. So this is the biceps break eye to orient you. I'm going to now walk into the treatment room so you get a free tour of my office. And here we go. Okay, so I'm already filming. I just did a little intro in the other room with an image of the muscle. So here's my patient's shoulder. And sorry, I just dropped something that I need to explain to you. And so I am needling. Sorry about that. Hope I didn't show your face. No, you've got a mask on, good. So preliminarily, I've needled his upper trapezius, the 3 trigger points in upper trapezius, which I like to do a lot of the time when I'm working on the shoulder, because then if you relax the upper trapezius, it helps the whole shoulder overall to relax. And so here I am needling the short head of the biceps muscle. And these were places where we found, sorry for the bad camera work, we found really, take a nice breath next. So there we go. So that is the pistoning technique, and that is the tendon releasing. That's really the fascia and the tendon. I'm not exactly needling into a trigger point. And here also, this is the long head. So the long head originates on the glenoid tubercle, and the short head originates on the the end of the scapula here with the coracoid process. And so I actually, before I needled these, I did needle to the tendon attachment. Sorry, I'm really bad camera work. I did needle here at the tendon attachment directed towards the tendon, and I didn't really get much release. So I think the real problem is here at the top of the muscle. And the thing is that I wanted to say is that this short head of the biceps that I'm needling here overlaps with the origin tendon of the coracobrachialis. And the coracobrachialis muscle is the primary, one of the primary, if not the primary flexors of the shoulder joint. And this patient's problem occurs when he's in flexion and pronation. So that's why I needle the both heads of the biceps and also the coracobrachialis. So that one's not so bad. That one's okay now. I got a pretty big release on that initially. And sorry for the shadow. And here we go. Okay, so the really strong one was this one here. I'm going to release it one more time. There we go. I mean, when the person can handle it, I like to do the pistoning technique like that until it stops jumping, and now it has stopped jumping. I'll take all of those out in a moment and rub some Chinese liniment on, and possibly do some heat therapy. And now we're on the long head of the biceps, and that black mark is where he was identifying the pain when he was standing in the other room. And so now we're done with that as well. And then other muscles that I like to get in this case, I did something on the deltoid here, which is pretty strong in his case. And then the other thing is that the on the forearm here, when we talk about pronation, because his pain is with flexion and pronation, there's also the brachialis muscle itself. So I've needled that as well. And so that's here, and I really need 2 hands to needle this properly, but this is the direction, and so we're doing across the fiber. So that's it. Dry needling for a early middle-aged man who's a martial artist. Thanks for tuning in.